Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. I've started a series of role plays for the doctors and nurses, and in this series, I have chosen the topic for the nurses today. And the nursing center is the setting of the role play. As nurses, one thing very important when you're starting any task, introductory part is very, very important. So you have to consider this according to the setting. And only then you have to introduce yourself to the patient. In this, the patient has come to you. It is a 75 years old patient's daughter or a mother, attendant. You can say that you're talking to attendant of the patient, not directly to the patient. And the person is concerned about his father's condition as he has frequent episodes of falling, and now he thinks that his father is getting weak also. So first of all, you have to introduce yourself by saying that good morning, my name is, or hello, my name is so and so, and I am in charge in this community nursing center, or I'm a tanning nurse of yours today, or it may be that I am the charge nurse of community nursing center. In this way, you must introduce yourself, and then the next part will be how may I help you, or what brings you here today. The patient will tell that I have come in regards to my father, who is your patient, and he is having frequent episodes of falling. Then you have to ask the patient for the documentation purpose, may I check the identity of your father? What's the name of your father and how old is he? Then the patient may say that my father is 75 years old and his name is Harry. Then you, after recalling, you're checking your data, you may tell, yes, yes, Mr. Harry is our patient. And then you have to tell that I am fine. It is a role of the patient that he will tell that he has frequent falls and I am not able to understand what is happening to him. And along with that, the patient is going to tell you that he has lost weight over the last 6 months and wants some advice regarding this. So, nurse, your role is now to ask certain questions to the patient as you are not able to get the proper information. Then you may say that, can you please elaborate it a bit more to me? Or you may start direct questions. This will be the open-ended questions. You may ask the person that how would you like to be addressed. The patient may say that my name is Joseph. Then you can say that, Joseph, can you please tell me more about your father, as I want to help you in this case only if I get the proper information. The patient, this person will tell that my name is um, Joseph, and my father's name is Henry, and he's 75 years old, and he falls frequently. And I think that he has lost some weight in the past also. Then you have to ask that, have you found any sudden changes in the behavior of your father? That if he has reduced his diet or increased his diet, or his behavior in, I mean to say that he becomes annoyed, angry, frustrated, or he had mood swings. So these are the questions to be asked to gather the proper information. Then it may be that the patient has lost his appetite or has increased his appetite, or he has like lost his strength to do exercise. And you may ask that, Henry, can you please tell me, Joseph, it was a Joseph. Joseph, can you please tell me that what type of food does your father take? If the patient says that he is taking the normal diet, then you may say that, have you found any changes in his eating pattern? According to that, patient may answer. Then the next question will be that, does your father do any exercise? And as the patient is already having the episodes of falling, then his daughter or son may tell you that nowadays my father is not doing any exercise because he has frequent falls and we don't allow him to go out for any type of the exercise, or in the house also he is not able to do. Then the next question will be about his medication. Is your father suffering from any other ailment? I mean to say diabetes, hypertension, or high cholesterol, or he's taking any type of the medication? Then getting the answer for that, then your next question will be any recent illness. Has your father had any episode of fever or anything else, or he has any surgery in the past? Then because this is the only way by which you can gather the information regarding the patient and give proper advice to the patient. And the patient, the son wants to know that if his father is suffering from something serious, or he is expecting some results from your side, then being a nurse, you have to tell that, Joseph, I am not authorized to make any diagnosis. For that, you have to bring your father to the hospital for proper checkup, and the doctor will examine your father. Only then the proper diagnosis will be made, and your father will be given some treatment. Because I am not in a position to give you any advice here what to do in this case, because your father needs a proper checkup. Only then any decision can be made. Then recommend strategies for encouraging his father to see a doctor, and explain the importance of being a sales to doctor. So I've already told you. Then you may ask the patient that, Joseph, you may accompany your father, or you may send someone else. Your father should not come alone to the clinic, as you already told me that he is vulnerable, or he is prone to falls. To avoid that, you should accompany your father, and I'll set up an appointment with the doctor. uh, are you comfortable to bring your father tomorrow at 10? Then the patient may tell this, it may be tomorrow or day after tomorrow. According to that, you may fix up the appointment. Then you can end up by saying that, Joseph, your appointment has been made, or your father's appointment has been made at 10 tomorrow, 10 a.m. tomorrow, and you should bring your father, and I'll send him to the doctor. And after the doctor's recommendation, the further investigation will be done. Your father's blood test, urine test, and all other investigation will be done. Only then your father will be diagnosed with any problem if he has, and according to that his treatment will be started. Because being blind at this time, we are not able to give you any solution, and the best way is to bring your father tomorrow, and get him properly investigated and examined by the doctor, and after that you may get any solution for your problem. In this way, you can end up this topic. If this topic was for the doctors, in that case the doctor may have made some investigation, but again, the direct was that the doctor has to recommend the patient for some investigations like blood, stool, urine test. Only then he can make some diagnosis and treat the patient accordingly. In this way, you can end up the topic. And I guess there's nothing left here in this task. Yes, all done. And now, at the end, you may say that, see you, Joseph, tomorrow at 10, and don't be late, because this appointment, your appointment has been fixed. Try to be here at least half an hour prior, so that your father should be comfortable while going to the doctor's chamber. So in this way, I'm going to end up this task. Hope this task will be helpful for you. And you can check all these recommendations which I have given to you, and you can see the task properly. If you like my videos, don't forget to like and share it with your friends. And you have not subscribed our channel yet, subscribe it right now, so that you should get the latest updates on our channel. And when so I'm up. Thanks for watching. Stay connected. Happy learning.